So we're often asked at Quay Dental about what the best way to replace a missing tooth is, or a failing tooth. And this is a case that we've just done recently, which is a nice case to show. So this is John. This is a picture of his tooth.
Good morning, Albie. I would just like to wish you certainly the compliments of the season. I'm in to have stitches removed on an implant last week. It went really smoothly. Actually, I quite enjoy coming to this practice. It's a very friendly place, and it's, I just, even as a kid, I was afraid of the dentist, and now actually I can go to sleep while I'm actually having my various therapies or what's the word that you use when you're having dental? Oh, treatments.
This crown that had been done a few years prior has failed. So when the crown came out, what we could see was the state of the root. We could see that it was clearly fractured down in such a deep way that it was impossible to be able to put that crown back again. So we decided on the best way forward would be to take this tooth out, and for John the best option in the long term to restore the gap was to have a dental implant. So what that entails is we carefully took that little bit of root out, and we allowed some healing time, and then this is his scan a few weeks later, which shows the situation where the gum has healed nicely, but unfortunately, because of the way that the tooth had broken, there was a little defect here with the bone that had shrunk back a little bit. So what we do in this case is we do some digital planning. This is where we get a 3D x-ray. This is a CBCT scan, and this allows us to do a number of things. It allows us to visualize any complex anatomy that we need to be aware of in doing these delicate procedures. And it also allows us to superimpose the perfect position for a tooth that we want in the end. It's what we call prosthetically driven. So the way that we plan the implant is all planned around where we want that final tooth position to be, which is a very important thing. So this software allows us to visualize the bone in these areas. It allows us to superimpose a virtual implant in there, which we then set to be the position and the angle, which is going to give us the ideal result with the end in mind. Now, when it comes to doing the surgery, what we do to make sure that we transfer this data onto our procedure is we make what's called a surgical guide. So this is a little device that at the time of placement we place over those teeth, and it allows us with pinpoint accuracy to place that implant in the ideal place where we've planned it. So for John, we came in, had the surgery, and this is the x-ray which shows the implant in place exactly where we placed it. Now, because we had that little defect of the bone around here, at the time of placement we did a procedure what's called guided bone regeneration, and it is where we augment this part of the ridge here to make sure that that implant is completely surrounded by bone. And what we do now is we allow him 3 months healing. The bone will heal completely around the surface of that implant so that it forms a solid structure. And once that's happened, we will then scan this, take it to make his tooth that will go in there. It will be screwed into the implant, and that will function and feel just like a normal tooth for him for many years to come.
And you did a great job. It was virtually pain-free, and I've had no problems through the week. Yeah, I found it very relaxing here, and a good bunch of people.